I'm secretly hoping that my wife will have a C-section because I don't want her to, you know, get all stretched out down there. Okay, so let's talk about this one. There is, and I have to address this in two different parts because we're dealing with a C-section where obviously the baby is not passing through the birth canal, thereby not stretching everything out. And there's also the notion of episiotomy as a way to tighten the woman back up. I'm going to start with the episiotomy thing because this is a myth that needs to get blown out of the water immediately should any of you think that episiotomy is good. Episiotomy, in case you don't know, actually is a lot of doctors, midwives almost never do it. A lot of doctors have stopped doing it, but for a long time it was very common in birth when the baby's head is crowning and just trying to come out into the open for the first time. You know, it's tough. It's like, you know, the skin is stretching, the tissue's stretching, it looks painful, it is painful. Doctors thought they'd help things along by taking a scissors and cutting the vaginal tissue just a little bit, sometimes a lot of it, to make it open up and so the baby would come out better. Clean and easy, convenient for the doctor. Oy, oy, oy. Episiotomy is really, really painful for the woman. Not in the moment that it's done, but in the recovery and in the amount of stitches. I think a typical episiotomy is something like 40 stitches. 40 stitches. Can you imagine like cutting your head or your elbow or something and having 40 stitches? Can you imagine like how many that is, what that feels like? Now imagine it in the nether regions and what that feels like to a woman. It's a horrible thing to have to endure. And it's falling out of favor for a lot of reasons. One of the things is that if a woman is having trouble getting the baby out, I mean, there are ways to just be patient and use lubrication, compresses. There's all different things that typically midwives do to help ease the baby out with a minimal amount of trauma to the area. But frequently women will tear, and for some reason we have an issue with the word or the notion of tearing. That sounds more out of control and dangerous than being cut in an episiotomy. But the fact is, when a woman tears, she's only tearing in the areas where there is stress. So what you'll end up with is maybe 2 stitches, 4 stitches, compared to the 40 stitches of an episiotomy. I could talk about episiotomies and why they're bad all day long, but the focus of this question was the myth that, oh, it's good to have an episiotomy because then the woman will be tightened up. Well, let me just explain something to you. Episiotomies, not only in the initial stage of being uncomfortable with all those stitches, eventually that'll heal and the stitches will dissolve and what have you, but they often leave scar tissue. And I know for a fact that there are many women who are debilitated by that sexually for months and months after they give birth, sometimes for even longer if the episiotomy was, sorry, I'm uncomfortable here. Hold on. If the episiotomy was particularly deep or aggressive. So this is not a beneficial thing. This is not something you should ever think about as a positive to be done to a woman, to tighten her up. But the other big part of the myth is that your concern is not the opening itself. Your concern is the tightness of the vaginal walls, really. And what happens is, during pregnancy and birth, everything opens up a little bit and softens and loosens. And part of that comes from the what's called the pelvic floor muscles. The pelvic floor muscles are sort of, if you could imagine, like a sort of a hammock that holds up all the organs, holds up the bladder, the uterus, and so forth. And that is why when women are pregnant, and that pressure starts to fall on the pelvic floor, they'll often suffer from incontinence. Now that doesn't mean like peeing their pants, you know, like a like a baby or something. It means losing pee occasionally if they're laughing or coughing or sometimes sneezing. When that happens to a woman during pregnancy, she'll know that her pelvic floor muscles are not as strong as they could be. And the reason I mention this is because it ties in exactly to this question, that after a woman gives birth, that's the first thing she can do to sort of get herself back to normal, is to do exercises called Kegels that strengthen the pelvic floor muscles. So so birth and the pushing stage certainly can stretch out the vaginal muscles to a point where a woman and her partner don't feel things the way they used to. But it's a temporary thing, and it's something that will come back to normal eventually. And certainly if she's doing Kegel exercises, or hopefully has been doing them during the time that she's pregnant, this will bounce back more readily. Let me just think if I answered that completely. Right, so, so about C-section. Okay, so C-section, yes, if a woman didn't have a pushing stage, if her baby didn't come out in that direction, then yes, she probably will be a little bit more toned, but only if she didn't experience any part of labor whatsoever. And there we're talking about more of like a scheduled C-section, which is unfortunately becoming more popular these days. But the idea for this particular question is, if your wife goes into labor and, is going through the whole thing and whatever, and it's frequently in the pushing stage that, a doctor will decide, oh, this isn't, the baby's in distress or this or that, let's do a C-section. So I guess what I'm saying is that a C-section isn't exactly your way around that happening. But furthermore, think about what you're saying. A cesarean section is major abdominal surgery, and the idea that you would, or anyone would prefer that over a more natural way of giving birth, it's a completely unnatural thing versus a natural thing, is just questionable to begin with. Not something you want to subject your wife to, and you certainly shouldn't hope that that's what happens to her. For any reason, whether that reason is selfishly motivated or you're thinking on her behalf or whatever, trust me, Mother Nature is always preferable to intervention.